Bismillahirrahmanirrahim. Assalamu alaikum everyone. Thank you very much for inviting me in the symposium for my talk. Now coming to my discussion about diabetes and its protocols used in rodents. I am Dr. Malik, PhD Pharmacology, Assistant Professor, College of Pharmacy, University of Sargodha. Now coming to the list of contents, here are the list of content including introduction of diabetes and its management, and finally we will go toward the chemically induced diabetes in laboratory animals that will be commonly used in laboratory animals. So here are two major parts. So first we discuss about the diabetes mellitus. Here is the diabetes is a chronic non-communicable diseases characterized by chronic hyperglycemia resulting from defects in secretion and or action of the pancreatic hormone insulin or both. It is a group of metabolic diseases and considered as leading global health problem. Diabetes is characterized into type 1, type 2, and gestational diabetes based on the etiology and clinical features, and certain other types are also found. Its prevalence is very high in the world, including Pakistan, in which it is the third most populated country and having highest degree of diabetes mellitus patients. So, types of diabetes, it is recently named into type 1 diabetes. Is given the adolescent diabetes or insulin subordinate mellitus diabetes, a condition caused by destruction of pancreatic beta cells by autoimmunity or autoimmune cells or T cells, resulting in complete insulin deficiency. It represents 5 to 10% of the patients with diabetes. Type 2 diabetes, also known as adult onset diabetes or non-insulin dependent diabetes. It is characterized by insulin resistance and relative insulin deficiency and is the most prevalent form of diabetes, accounting for at least more than 90% of all cases of patients. Gestational diabetes occurs during pregnancy in women, so it is 5 to 7% or 5 to 10% cases during pregnancy. So coming to the major uh, background of the type 1 and type 2 diabetes in the patients, how it's shown outside. If we see the symptoms, then we can define it. Type 1 diabetes is characterized by inability to produce insulin endogenously. So endogenously, insulin is not produced by beta cells. How it is not producing? Based on the series of histopathology studies of patients with recent onset of diabetes, it is commonly stated that onset of clinical symptoms corresponds to an 80 to 95% reduction in beta cell mass. So here is the number: 80 to 95% reduction of beta cells have happened in type 1 diabetes. So we have to give exogenously insulin to that patient. It will be called type 1 diabetes. So in type 2 diabetes subjects, initial pathological studies suggested a beta cell loss of 25 to 50% of the patient, but this has some controversies. So type 2 diabetes is mainly caused due to insulin resistance. Obesity is one of the leading cause of diabetes that causes diabetes. About 90% of the patients with type 2 diabetes are obese. So this is the major cause, major burden in the world. So we go toward the metabolic syndrome and prediabetes. Metabolic syndrome is a cluster of different symptoms, different syndrome, different metabolic parameter, increases metabolic parameters. So it can develop type 2 diabetes or cardiovascular problems. So it includes what are the major symptoms include abdominal obesity, high triglyceride levels, lower HDL level, or higher LDL level may be there. Higher blood pressure, high fasting blood glucose is also shown in metabolic syndrome patient. So now coming to the prediabetes, in which blood glucose levels are higher than normal but not in range for diagnosis of diabetes, because according to the American Diabetes Association, it should cross 125 milligram per deciliter. If it is less than 125 milligram per deciliter, so it will be called prediabetes. It is generally asymptomatic, so it is silent killer and will not be shown so it is called asymptomatic. Coming to the diagnosis, before that, we will see the symptoms. Major three symptoms are there about this diabetes. First is polyuria, increased urine; polydipsia, increased thirst; and polyphagia, increased food intake. So, on the basis of diagnosis, we can see diagnosis may be normal. You can see the values HbA1c in percent, fasting blood glucose milligram per deciliter less than 99%, and oral glucose tolerance test is less than 139 milligram per deciliter. In pre-diabetes patient, you can see 5.7 to 6.4 HbA1c level is there, and fasting blood glucose is higher than 100 to 125 milligram per deciliter, and OGTT test is 140 to 199 milligram per deciliter. And in the case of diabetes greater than 6.5%, HbA1c level shows diabetic patients or diabetes to that patient, and the fasting blood glucose level is greater than 126 milligram per deciliter, and OGTT is greater than 200 milligram per deciliter. So coming to the complication of diabetes, here are the macrovascular and microvascular complication of the diabetes, in which coronary heart diseases are also there, and nerve damage is neuropathy, kidney damage is nephropathy, eye damage is retinopathy, and the foot damage or foot amputation is also very common in different patients of type 2 diabetes or type 1 diabetes. Alzheimer's disease is also called type 3 diabetes, and skin conditions and skin problems are also shown in the complication of diabetes. Hearing impairment is also seen. So here is the figure shown about the cataracts, glaucoma, diabetic foot, and nephropathy, foot amputation, and stroke, heart attack, and multiple other diseases have been shown in the figure. So coming to the prevention and management of diabetes, so prevention is also possible. So awareness about and education of the diabetes should be there to are given to the patient. The mainstays of primary prevention of diabetes are a healthy diet and regular physical activity should be done. Regular diet and physical activity is very important. Avoidance of sedentary activities should be avoided, and the maintenance of healthy weight is very important for the patient. So reduction of 10% body weight can reduce the insulin level and other problems, hyperlipidemia and blood glucose level or hypertension in the patient. Avoidance of smoking, avoidance of environmental toxins is also said to be reduced. Using pharmacotherapy for management, insulin preparation should be given in the type 1 diabetes or in some cases of type 2 diabetes, and other oral hypoglycemic agents including metformin, glibenclamide, and some other available drugs that can be given to the type 2 diabetes patient only. So animal models of diabetes, in general, experimental diabetes mellitus is instigated in animals because animal model play an important role in understanding the pathogenesis of the disease. So this is very important. We can see animal models are being used from many centuries. So this, even though a number of in vitro and in silico studies are available, but animal model still remains the effective one in understanding the complex etiology and multi-systemic interaction present in diabetes. Animal model may be developed by two principal mechanisms, including using in the disease induction using specific drugs like Alloxan or streptozotocin are commonly used in induction of diabetes in different animals in rodents, or genetic manipulation is another method for induction of diabetes in different animals. So coming to the Alloxan induced diabetes model, organic this is basically organic compound is cytotoxic glucose analog, which is used to induce diabetes mellitus chemically by two mechanisms. One reports that Alloxan specifically inhibits glucose incited insulin emission by broad glucokinase restraint. So this is the glucose that enter glucose through this glucokinase enzyme to the pancreas of the beta cell. And the beta cell pancreatic glucose sensor, and it also induces reactive oxygen species creating a redox cycle generating superoxide radicals. Here is the structure of the Alloxan showing the glucose analogy with the glucose. So coming to the other, Alloxan is decreased to or converted into diol-uric acid, diol-uric corrosive compound that is also similar to 5-hydroxybarbituric acid, and then reoxidized back to Alloxan. Further, this conversion is continues, making superoxide radicals that experience this mutation by superoxide dismutase to form hydrogen peroxide or hydroxyl radicals, which make highly reactive oxygen species that cause destruction of the beta cell DNA fragmentation, leading to apoptosis, which is programmed cell death. So there may be type 1 diabetes if we use a high dose of the Alloxan. If we go toward the lower doses, then it can cause type 2 diabetes. Doses of the Alloxan extend from 50 to 200 milligram per day per kg in mice and 40 to 200 milligram per kg in different rodents or rats. So coming to the mechanism of action of Alloxan induced diabetes, in which you can see if Alloxan is given through intraperitoneal and intravenous route, then it is converted into diol-uric acid, that is form of uric acid with some other compound, and the reduced glutathione converted into oxidized glutathione. It tries its best to stop this mechanism, but the concentration of the Alloxan is higher, so it converted into diol-uric acid, and Alloxan radicals further converted into reactive oxygen species, and with the help of SOD, superoxide dismutase, hydrogen peroxide is formed, and it converted into hydroxyline, which is very highly reactive oxygen species, and it causes beta cell damage to the pancreas and induces the diabetes in animal model, depend on the different doses. So coming to the another method that is commonly used for diabetes induction in animals, laboratory animals. So streptozotocin or STZ induced model. This is basically naturally occurring compound produced by Streptomycetes acromogenes with antibacterial properties that are selectively taken up by pancreatic beta cells, causing its destruction. It is also cytotoxic glucose analog like Alloxan. So this is again coming to the toxicity of the pancreas due to the analogy with glucose. As it enters glucose in the pancreas, so there is a start of insulin secretion. So these goes and break down the cells, damages the cell and destroys the cells due to the analogy of the glucose. It is basically nitrosourea compound with a toxic glucose and N-acetyl glucosamine analog that gets accumulated in the pancreatic beta cells that through glucose transporter 2, transmembrane carrier protein transporter uptake. So it go to the cell and destroy it, and further streptozotocin induce diabetes in rats, mice, rabbits, and guinea pigs through two ways depending on the dose. In the high proportion streptozotocin technique to mice by intravenous or intraperitoneal routes, 100 to 200 milligram per kg, or in rats 35 to 65 milligram. Dose is given very less in rats, you can see, and producing massive pancreatic beta cell destruction with little or no insulin production. It means it is causing type 1 diabetes. If we want to produce animal or induce animal with type 2 diabetes, then we have to add nicotinamide to protect the beta cells, 120 milligram per kg for the induction of type 2 diabetes in addition with streptozotocin. So on the other method, various low doses or low portions streptozotocin with little doses 20 to 40 milligram per kg per day ought to be directed over some undefined time frame to advance insulitis. So this is the method that induces pancreatic beta cell damage with slowly or low portion streptozotocin method. Now coming to the main mechanism of action of the streptozotocin, here the structure of streptozotocin, and we can see A, B, and C form. So in first form, streptozotocin is given through intraperitoneal and intravenous dose in mice and rats that can destroy directly beta cell destruction. On the other hand, if we go the multiple low doses to the animals, then it causes the beta cell decrease, and you can induce type 2 diabetes or type 1 diabetes through this method. And the other method, you can see another mechanism that is showing about streptozotocin goes toward the glucose transporter 2 and enter and do DNA alkylation or side effects, and further it decreases the ATP product reduction and alter insulin production in the beta cells. So these are the methods that are commonly used for rodents. So coming to that, I have finished my talk about uh, diabetes and its protocol commonly used in different rodents. Thank you very much for inviting me. If you have any question, you can ask from me. Thank you. Allah Hafiz.